Hi, everybody. It's me, Fran Drescher, the founder and visionary of the Cancer Schmancer movement. And we are bringing you now a special series called Corona Care for You. And I'll be interviewing our medical advisory board, leaders in the health space that we feel can impart a great deal of wisdom to all of you at home so you don't feel helpless and hopeless, but you feel educated, motivated, and empowered. So I'm very happy to be speaking today with Dr. Gerry Curatola, who is a wonderful biologic dentist, and he wrote the incredible book, The Mouth-Body Connection. He is also my dentist, and I think that he's going to offer us a lot of interesting information about the mouth-body connection. So welcome, Dr. Curatola. It's great
Thank you. Thank you, Fran. It's great to be here. It's always great to be with you. Just seeing you is uplifting.
Oh, that's so nice. Thank you. I appreciate that. Thank you. Thank you. So let's get right into it. I mean, you wrote the mouth-body connection. Could you explain that a little bit? What is the mouth-body connection? Because I don't really think that the average person connects anything that's going on with here to everything that's going on everywhere else.
Exactly. So, 150 years ago in this country, we took this part of your body and we separated it from everything else. And we said, the people that wanted to study here, we said, go to dental school, and you guys go to medical school, and then we chopped off the feet. And we said, you go to podiatry school. And the reality is that that's not only illogical, but it's very damaging to understanding the fact that your mouth is a mirror and a gateway for everything that's going on in the body, right? So you have 86 to 90% of systemic diseases have manifestations in the mouth.
Wow.
And you have,
I really want to offer people, immediate practical solutions, things that they can do right now in their home to help support their immune system and to learn truly what healthy oral hygiene is all about and why.
Yeah, that's great. So a healthy mouth, in Ayurvedic medicine, they said, you can't have a healthy body without a healthy mouth. And what they meant, or they actually used the word clean. You can't have a clean body without a clean mouth. And that idea of clean, like toxins are pollutants. COVID-19 is actually a pollutant to the cell. Mm-hmm. It's not even many people believe, it's a
living
essentially
thing.
A protein, there's RNA and DNA, and what it does is it attaches itself to a receptor site, if this is your healthy cell, and then it embeds itself, and it takes over cellular machinery and things like that, almost like a cancer cell does. And that's why there's a whole concept about viruses being behind cancers and things like that, parasites being behind cancers. There's a naturopathic doctor, a friend of mine, Linda Lancaster, who talks about she never saw a person with cancer without an underlying parasite. So very interesting theories, very interesting philosophies. But the one thing we know is that disease in the mouth is probably 90% of disease in the body has manifestations or sources in the mouth. Perfect example is gum disease, right? Bleeding gums. I always tell patients, they go, oh yeah, my gums brush when my gums bleed when I brush. And they think, it does that all the time, like it's natural. And I'm like, if you brushed your hair and your scalp was bleeding, would you think that was natural? No, that's a sign of chronic inflammation.
And isn't it like a bacterial overload? I mean,
yeah, yes, and there's 4 things that go on, and it really, the gum disease is more a result of an imbalance in the microbiome, this microbial flora of the mouth. So that inflammation has ravaging effects on your whole body. So that's why the big thing about coronavirus, about COVID-19, it's not even that virulent a virus. We're really, we have the crap scared out of us, and we have this unprecedented shutdown, which I can understand the rationale on many different levels. We can talk about that. But the reality is the best way to defend yourself against coronavirus, COVID-19, is not to run or wait for a vaccine, but to build your own native innate immune system.
I could not agree with you more, and thank you for driving that home for us. It's just, and that's actually why we're doing this thing, and why, you're so perfect to be speaking to at this time, because I feel like there is an omission of information on
Absolutely.
the airwaves, and no one seems to be talking about this.
Absolutely.
And also, the people that are being stricken the hardest by the virus are the ones that already had compromised immune systems, even if they did not have pre-existing conditions. Someone that gets colds often, someone that has bleeding gums, someone
that has sleep apnea. Here's the thing, when they talk about, oh, so-and-so, a 42-year-old young man, nothing wrong, succumbed to COVID-19. And, he got that degenerative process of the sudden acute respiratory syndrome. They put him on a ventilator. A lot of people are being put on automatic ventilation. Very, very dangerous, so they don't have to be monitored. They're finding that there are statistics coming out right now that whether you're on the ventilator or not on the ventilator, you're going to die either way. So the ventilator did not seem to decrease the morbidity from the pneumonia and the onset of the virus. The ventilator may have bought a little bit of time, but
some people get better and go home, even if
there's a number of different things. I want to go back to obstructive sleep apnea. 75% of us have obstructive sleep apnea, and we don't know it. We don't know it. So what is obstructive sleep apnea? It's a narrowed airway in the back of your mouth, soft palate, and the larynx, where some people, they have very, very narrow arches, and they have not enough room for their tongue. So the tongue, there's a book called The 6-Foot Tiger, 3-Foot Cage. Your tongue is a huge organ. If you have a narrow arch, if you had teeth pulled for orthodontics and your arch is narrower, there's less room for the tongue.
What is the arch? That circular roof of the mouth?
It's what your teeth are sitting in. It's the jaw.
Oh, so it's this.
There's the maxillary arch, the maxilla, the mandibular arch, the mandible. Some people, it's very narrow. There's not enough room for their tongue. The tongue is pushed back. Some people have a narrower face, sort of like the shape of my face, and that end up with high vaulted palates. Children that aren't breastfed they don't have normal palatal development from latching on to a mother's breast actually helps with the formation, normal palatal development. So if you have a high vaulted palate, very high palate, if you have a tongue tie, which many people have, where they can't touch the roof of their mouth with their tongue and open and touch the roof of their mouth, they have a tongue tie. All of these things affect the ability for you to breathe. They affect the ability for you to get oxygen. How are people dying from COVID-19? It's a respiratory virus. It sets up a respiratory distress, onset of pneumonia, less oxygen being taken in, organ shutdown, death. This is what it's related to. If you can't breathe through your nose and you're breathing through your mouth and your tongue is the 6-foot tiger in the 3-foot cage, look at all this. By the way, hypertension has been a risk factor for complications with COVID-19. That is the same risk factor for people. I've had patients with no other issues, and they have hypertension, they have sleep apnea. We correct the sleep apnea, the hypertension goes away. So one of the things that I think it's really important to address is this epidemic of airway health. We have to breathe. It's funny, this virus is a respiratory virus, and it's focusing on our ability to breathe. Yet a lot of people have it. So in biologic dentistry in our office, it's a major area that we're looking at for screening people and treating people. And the treatment is very, very simple. So what we used to use was this. This is forced air. So this pushes air into the back of your throat, kind of like a ventilator. Pushes air, except the ventilator is going right down into the bronchial tubes, and it's much more invasive. This seals over the outside of your mouth. It's forcing air in. The problem with this is it's stretching the soft palate and the larynx like a balloon. You blow a balloon up so many times. Now those muscles get flaccid. Besides the fact that this is ridiculous to wear at night, it's treating the symptom and not the cause. This is an appliance. It's called a DNA appliance. It's an adjustable appliance. You wear it every 3 to 5 days, and it expands the arch to allow the tongue to come forward. So
I see. So this is the dental apparatus that
yes,
opens up the arch of your mouth.
exactly. So if you look at the arch on the left over here, you see how narrow that is?
Yes.
And the high vaulted palate? The
Yes.
appliance turns it into this. Now you have room for the tongue to come forward.
Is this almost always the cause of sleep apnea? A misshapen arch?
Yes, what we're finding is airway. Some people are breathing at night through a coffee straw instead of having a tube. It's that instead of that.
And that's usually the result of a misshapen arch of your...
Yeah. So that book by Dr. Felix Liao is called 6 Foot Tiger, 3 Foot Cage. 6 Foot tiger is your tongue. The 3 foot cage is your mouth. So if you look on the left here, there's no room for that tongue. This person is gasping for air at night.
Wow.
So this is an important preventative thing that will change your life.
How long did it take them to have their mouth move into the 38 to 42 millimeters?
So this, and basically I would say this is, you wear this over the course of a year. Sometimes longer, sometimes less. Some people, the younger you are, the quicker the arch reforms. The older you are, the arch will continue to reform. The palate comes down. So the thing about a high palate, what you see on the left, is that obstructs your ability to breathe through your nose. So you hear a lot about nitric oxide production.
What do they call this apparatus?
DNA appliance. So.
And it is, is it mostly more biologic dentists like yourself that are embracing this technology?
Yeah, yes. For me, this is a cornerstone of biologic dentistry and a biologic approach to oral health. We're going to talk about the other things in a moment, but I wanted to introduce this because COVID-19 is just an example of an, could be influenza, it could be, but it's a respiratory virus.
And certainly something that I'm going to tell my friend who is currently, I think, sleeping with some kind of a nostril tube or something. But
anybody who is having trouble breathing, snoring is a sign of sleep apnea. It's not the only sign. If you snore, you have a good chance you have sleep apnea. Sleep apnea is stopping breathing. It's funny, the two things they said that are going on right now in homes is like a lot of babies being a lot of babies being made and a lot of divorce. So one of the things we were talking about what you can do at home, having talked about sleep apnea, we can send you a home sleep study. We have a new study that we send it to you. It's disposable, right? Hooks on your finger, and on here we can measure respirations. We can measure what your oxygen saturation is. Your oxygen saturation, very, very important.
I wouldn't mind trying that.
I'm going to send one to you. I'm definitely going to send you one. The other thing is we evaluate cone beam. I'm doing a lot of digital consults. I have a great doctor who's a national airway specialist, Dr. Dean Rayo. He's a dentist who's a an airway specialist. And he's actually a major scientific advisor for that company that makes that appliance. So I brought him on the team because this is epidemic, the ability for people to breathe. It's epidemic. Because if you can't breathe, you are not going to do well when you get a virus like this. You know, I think this was our 9/11 event for healthcare security. COVID-19, this pandemic, was our 9/11 event.
Well, I hope that, you know, the positive silver lining of all this is that people are going to realize that how they live equals how they feel. And it's high time that we start living the cancer schmancer way, which is detox your home, your life, the food you're eating, go organic and eco-friendly, period, end. Because everything that we expose ourselves to, from industrial farm, glyphosate doused food and toxic chemicals in cleaning supplies and, you know, personal care items and strong smelling products are all eroding our immune system.
So, you know, and I'm so proud to be a part of the Medical Advisory Board of Cancer Schmancer.
Thank you.
And you brought great doctors together. You brought great doctors. You have, you know, so many incredible Zach Bush. So Zach is doing in the gut what I'm doing in the mouth with products like, you know, Revitin, right? So why do I do Revitin? Revitin
which I use all
rebalances the oral microbiome. Doesn't kill it, but it makes peace with our microbes that keep us alive. And you could eat it. So let's talk about what to do at home, right, in terms of the mouth?
Yes.
Get the junk out.
I have a whole routine, you know. I mean,
so someone in my house brought this home, right? Notice it's not even open.
Yeah, well, you can't, because they say that
very bad for virus replication.
Right.
Bad for that.
Right.
So the first thing is
ACE inhibitors. They say don't
ACE inhibitors, because it's an ACE receptor. You know, it's an ACE inhibitor receptor. And
selenium, I heard, is not good.
Selenium's out. Zinc is good. Vitamin C.
Good. Vitamin C is good. Yes, we have to take our D.
I have a lot of props.
Yes.
Well, macadamia nuts.
Oh, I love macadamia nuts, as long as they're organic.
So let's talk about some of the things that people need to do.
What is the routine that you recommend for the average person? And let's say, you know, all they have right now is those terrible toothpastes that say do not swallow or call poison control. Let's talk about, we're stuck home now. This is the first time we're ever hearing this. What can we do with what we've got in the house, and where do we begin?
Cornerstone for being healthy is nutrition. So I am really excited because I was working on, you know, a lot of patients that have cavitation surgery with me, or laser surgery and different dental procedures and things. And they may have to be on a soft diet for a while. And I know it was always like, oh, well, you know, make a protein shake, or, you know, go buy a protein shake. I have this, I just came out with this.
Oh, okay.
It's called Optimal Nutrition. And I did it for patients that need something. And so this is a phytonutrient blend.
You mix
this
it
is
with
the
water?
fruit one that has acai, goji, mangosteen, noni, and pomegranate. Then I had one with turmeric, kale, kelp, and a whole bunch of other phytonutrients in a phytonutrient vegetable blend. This is the fruit one, which is natural strawberry and kiwi. And I made it this morning. It's amazing. I just got it.
With what do you make it? Do you mix it with water?
Coconut, you can do water, but I do coconut milk, oat milk. I really turned on to oat milk lately.
I like oat milk.
Coconut, but oat milk is really coming on strong. Great. I do frozen berries in it. I do frozen berries organic berries, some oat milk, a scoop of this in a blender, takes 30 seconds, and I have this amazing smoothie. Then I add this. This is another one. I'm really proud of this thing. This is optimal collagen. This is what everybody needs. I'm giving this to every patient. It's a big can, but it's a 1 month supply, 30 servings of collagen. What's collagen good for? Bone healing, teeth remineralization, skin, your beautiful skin, your beautiful hair, your nails. So all that ectodermal tissue, we need collagen, especially when I clean out a cavitation and I use, stem cells and platelet-rich fibrin and bone mineralization. Your body does the healing. Collagen is great for that.
So would that collagen be good for vegans or?
Yeah, this is vegan.
It is.
This is. I know you're vegan.
I have been.
Please tell everybody that story.
I know.
You thought I was vegan. I thought you were vegan.
Well, now I wanted those zero in specifically on, our oral hygiene practices.
Yeah.
So I know that, I live with a water pick. I love my water pick. Yeah. I use pristine water, not tap water.
Exactly.
And I put in a splash of some kind of mouth rinse that I like.
Awesome.
Every time I eat, I use it. I also floss. One of the things I learned through your hygienist was taking the what's it called? Dental floss, and doubling it. So it's a little bit thicker to really kind of.
So let's talk about floss for a second, because there's a lot of do I floss? Do I not floss? Do I floss? Here's the bottom line. The reason why floss is important is because to really get through the contacts of how the teeth touch, floss is the easiest to get through the contact. And you sweep one side, sweep the other side. You can double it if the contact is loose enough. You can double it. You can use little tiny brushes called Interprox brushes to clean out debris between teeth. Why is that important? Whether you use floss, whether you use interdental brushes, interdental stimulators, or rubber cleaners, rubber points. And I said this on, it's funny, I was on the Dr. Oz show because some study came out and said, oh, you don't have to floss. So everybody thought like, oh, great, because people, they have trouble holding it. And old people, they can't use it that well, and they're not as dexterous as you. So it's really,
like a minute away from being an old person.
You're 1 month older than me. And you look 15 years younger.
You're very kind.
So the thing about floss, this is what I said on Dr. Oz. It just came to me, and I said, Dr. Oz, the area in your mouth where food and bacteria will accumulate is interdentally. The smooth surfaces of your teeth, the outside and the top and the inside, are easier to brush and clean. In between your teeth could be compared to the alleys between buildings on a New York City street. And if you don't, clean out between there, like the garbage cans, if you don't empty the garbage cans on the sides of buildings in that area of Queens that you grew up in, it's gonna, a hot summer day, which our mouth is, it's warm, it's dark, it's moist, it will start to smell, and then the rats come out, okay? And so what you really need to do is pick up the garbage. So you need to use floss at least once every 24 hours or an interdental cleaner. You mentioned a water pick, and you mentioned that you put a drop of essential oil. Did you say something?
I didn't. No, I put a splash of whatever mouth rinse I'm using at the moment.
Yeah, so that's.
And I
That's
use
fine.
the electric toothbrush too with my Revitin, which is your toothpaste.
Right.
That
I
helps.
would rather you use 1 drop of a lemon or tangerine oil in your mouthwash, because if you read the label on most mouthwash, even natural mouthwash, they use a lot of antimicrobial, bug killing oils, tea tree oil, peppermint oil. I use peppermint oil on my garden outside over here to keep the bugs off the tomato plants. And so we got to get out of that bug killing mentality, because Zach Bush and I both know we're both microbiome experts. We have over 20 years studying this. He did the gut, and God bless him, he came out with a product that reverses the damaging effects of glyphosate. And I developed Revitin to reverse the damaging effects of what we've been doing to our mouths, because we really want to promote microbial homeostasis. Because the bacteria in our mouths do amazing things. The bacteria in our mouths take minerals from saliva to remineralize our teeth. It's an intelligent, semi-permeable membrane that transports minerals from saliva and oxygen to the gums, takes waste products away when it's in balance. When
Well,
it's not in balance,
I
yep,
think that balance is the buzzword for this interview. I think, you have to have your mouth microbiome in balance so it operates at an optimum and doesn't become a gateway for dis-ease. You have
exactly.
to make sure that your breathing when you're sleeping is balanced breathing, or you're opening yourself up to being vulnerable to a whole host of respiratory problems, and particularly what we are all dealing with right now in this time of the COVID-19 pandemic. So that's another helpful thing. I'm very interested in knowing more about that DNA appliance. And you've also said that you need to have nutritious balance, and you showed us, different products that you have developed.
Green,
Oh,
green, green, green.
yeah, but don't do it in a plastic bottle. I
Got me.
got a slow juicer that comes from Korea, because a chef once said to me that the best ones come from there, and I throw in all my vegetables, and I put it into a jar right into the refrigerator. And I think it behooves us all to go back to the way it used to be and just kind of make your own,
Right.
and steer clear of the plastic, because that too is going to bury us alive and destroy our oceans and all life. We have to start paying attention to our actions and what the long-term consequences of that is. And that's why, we're doing this series right now, because we're trying to wake up and shake up Americans and our members all over the world to realizing that it's time for us to use this period of self-reflection and isolation to really examine how you are contributing to your own dis-ease and that of the planet. So I cannot thank you enough, Dr. Curatola. You're just I don't even want to call you a dentist. It doesn't even seem like, it seems like it's not enough to just call you a dentist, but you're really brilliant. And I'm so thrilled to have you be part of the Cancer Schmancer movement. And I hope that, this discussion that we've had has been useful to the viewers. And we just want to wish everybody here at cancerschmancer.org good health. Our prayers are for you. And know that you're not hopeless, you're not helpless. There are things that you could be doing right now to help your body help you. And
Can I add one last thing?
Of course.
It's very important that people stay healthy in mind, body, and spirit.
That's
and
true.
I was talking about staying healthy in spirit, because there's a lot of damage right now. You don't realize being separated causes a lot of depression.
And not
That's
everybody has
separation.
access to this kind of, computer technology.
Yeah.
There are shut-ins that don't even have a pet, and they're very isolated and frightened, and watching the news, which is not helping their spirit either. So one of the things that I've learned while in the moments when I've been in the depths of despair, which has become a life lesson for me, is that side by side with grief lies joy. And in the darkest of hours is when we have to pull ourselves up and seek out that joy, because it's not the whole pie we're experiencing. It's a slice of the pie.
Yep.
And it behooves us to experience all the other slices of the pie, which is being gratitude, being closest to our Creator, trying to be healthy, connecting with our loved ones,
Yep.
and staying calm and learning new habits on how to bolster your immune system, support your immune system, so when push comes to shove, your immune system can support you.
Absolutely.
We
And we're
thank you.
watching a lot of old episodes of the nanny, the whole crowd, so we could get some laughs, and it picks our whole spirit up.
Laughter is
So
the
you're
best
doing a good
medicine.
job at bringing the joy. Keep bringing the joy.
Thank you. Thank you. Well, laughter is the best medicine. And I appreciate you mentioning that. And you be well. And I hope Georgia, your wife, is well too. And everybody, all of your loved ones. And hang in, as we all will. And thank you. We appreciate you. Thank you so much, Dr. Curatola. Hi, everyone. It's me, Fran Drescher. Well, I hope you enjoyed Corona Care for You. And if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events. So it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Corona Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.